Hello, my name is Bethany and I'm the Skin Cancer Care Coordinator. Today I'm going to be talking about what is skin cancer. Our bodies contain cells which make up our organs and tissues. Cells create new cells by dividing in a controlled way. This enables our body to grow, heal and repair. Our cells die off naturally when no longer needed or unable to repair themselves. Sometimes cells can go rogue and stop behaving how they should, creating an abnormality. An abnormal cell can behave differently by continuing to divide, making multiple abnormal cells. These cells eventually then form a lump, also known as a tumour. A tumour is a simple word for a mass or a lump and is not always cancerous. We can identify whether a tumour is cancerous by performing a biopsy, where a small sample of tissue or cells are removed and looked at under a microscope. If the sample comes back with no evidence of cancer, this is identified as a benign tumour. Benign tumours don't have the ability to spread to other areas in the body. If the biopsy sample shows cancerous cells, this is identified as a malignant tumour. Malignant tumours sometimes have the ability to grow into nearby tissues and potentially can travel into the bloodstream or the lymphatic system. This creates a risk that these cells could generate further cancerous tumours, known as metastases or secondaries. There are three main types of skin cancer, which are basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. The most common type of skin cancer is a basal cell carcinoma, which you may hear being referred to as a BCC or a rodent ulcer. Basal cell carcinoma is a very slow-growing form of skin cancer and does not normally have the ability to travel to other parts of the body. They can often be quite easily cured with an operation. Basal cell carcinomas can cause problems if they grow in areas very close to the eyes or if they are left untreated for a long time, as they could then spread into deeper layers of the skin, making them difficult to treat. BCCs may appear like an open, non-healing sore, a pinkish growth, red patch or irritated area of skin, a shiny nodule or a scar-like patch. The second most common form of skin cancer is a squamous cell carcinoma, also known as an SCC. This is a cancer which grows in the outer layer of skin and is most commonly found in areas of the body that are most exposed to the sun, such as the head, neck, chest, upper back, ears, lips, arms, legs and hands. A squamous cell carcinoma can often grow quite quickly. Some squamous cell carcinomas have the potential to travel to other parts of the body, most often to the nearest lymph glands. SCCs may appear as a persistent scaly patch, an elevated rapidly growing lump with central depression, an open sore or a wart-like growth. The final most common skin cancer is a malignant melanoma. Although melanoma is rarer than a BCC or SCC, it is the fifth most common cancer in the UK, and numbers of diagnoses are rising each year. Melanoma can grow much quicker than a BCC or SCC and should be treated as early as possible. If the melanoma has only grown in the upper layer of skin, this is classed as a non-invasive melanoma. If not removed or spotted early, the cells can continue to grow deeper into the skin, to the deeper layer where there are blood and lymphatic vessels. This is known as an invasive melanoma. There is a risk that invasive melanoma could travel to other areas of the body via the lymph vessels or via the bloodstream. The risk of invasive melanoma travelling elsewhere depends on the thickness of the melanoma when it is removed. Thin melanomas have a low risk of travelling. Melanoma tends to present as a mole that is growing, changing in shape, changing in colour, or causing itchiness or bleeding. To find out more about the warning signs of melanoma, please watch our Melanoma ABCDE video.